You've been invited for a CT scan of your chest, abdomen and pelvis to help in the diagnosis of your condition. CT, or computed tomography, is a special type of X-ray which allows us to see soft tissues and bones inside your body. CT scans are quick, painless and generally safe. The amount of radiation you're exposed to during a CT scan varies depending on how much of your body is scanned. The scanners are designed to minimise your exposure to radiation, but if you have any concerns, please ask your doctor or radiographer about the potential risks. There are some important things you need to address before you come for your scan. You may eat and drink as normal unless instructed otherwise. Please take all of your medicines as usual on the day of your scan. Bring a list of your medicines with you so we know exactly what you take. If you have diabetes, please ring the radiology department for guidance. If you take metformin, glucophage or glucovance, we will normally ask you to stop these for 24 hours prior to your scan, and you mustn't take them for 48 hours afterwards. Ensure you drink plenty of water during this period. If you use insulin, you will be given advice specific to your circumstances. Please let us know before your appointment if you have any mobility problems for which you may require assistance, or if you need to arrange transport to or from the hospital. Also let us know if you're pregnant, think you may be pregnant or are breastfeeding. Wear loose clothing, but please choose something without metal buttons or clasps. You will have to remove all your jewellery or hair clips, so it's best to leave these at home. It's best to arrive in plenty of time. Hospital car parks are busy, so allow time for this and bring change for your ticket. You may want to ask a partner, friend or relative to be with you, but we suggest that you do not bring young children as there are no facilities available to look after them. You should expect to be in the hospital for up to 2 hours. Sometimes scans are delayed due to emergencies, but we will keep you informed about likely timings. On arrival at the radiology department, you'll be given a drink of contrast agent, either water or an aniseed flavoured drink called gastrographin. The contrast agent improves our ability to see your organs on the scan. Please drink the contrast agent slowly, over 45 minutes to an hour. You'll be called into the preparation room where you'll be met by a radiographer, the person who performs the scans, or a support worker. They will need to insert a cannula into your arm. A cannula is a small needle with a plastic tube covering it. We insert the cannula into a vein in the back of your hand or into your elbow crease. During the scan, we will inject a contrast agent through the cannula to improve the quality of the pictures. You will then be invited into the scanning room and met by a radiographer. The CT scanner looks like a giant polo ring, and you will lie on a bed which goes through the middle of it. The contrast agent will be injected into your arm. It's not painful, but can give you a warm sensation. It may give you a metallic taste in your mouth. Some people experience a warmth down below which feels like they've just been to the toilet. You will ideally need to raise your arms above your head as the bed glides into the scanner feet first. The bed will move backwards and forwards as the scan is being performed. You will not feel anything and you have plenty of space around you. When we take the images, we will ask you to hold your breath for a few seconds at a time. The scan does not last for long, but you need to remain very still whilst it's happening. You shouldn't experience any after effects from a CT scan and can usually go home shortly afterwards, although you will be advised to wait in the hospital for around 10 to 15 minutes to make sure you don't have a reaction to the contrast agent. You can eat and drink, go to work and drive as normal. The images will be looked at by a specialist X-ray doctor who will write a report. If your hospital consultant requested the scan, the report will be sent to them and you will receive details about a follow-up appointment. If your GP requested the scan, please check with your surgery that they have received the report and then make an appointment to see your GP. This usually takes 7 to 10 days. If you have any questions regarding your scan, please speak to your doctor or contact the radiology department.